You can see yourself, yeah. All right. Hi, good morning, everyone. Good afternoon, good evening, depending on when you're watching or where you're watching this live. This is the voice and face of Dr. Tolu Olabintan of Living Spring Family Medical Center, where we help our patients live long and well because we believe the quality of life is just as important as the quantity of life. I'm very excited to be here doing another live today where we're talking about kidney health, how and why we should take care of our kidneys, talks with the kidney doc. I am honored to have my friend and nephrologist and internal medicine doctor, Dr. Ndidiamaka Obadan. She's also known as Dr. Didi. Now, I'm going to give you a chance to introduce yourself because for those who are watching now, who are watching a replay, they're like, okay, who is this doctor? So, Doc, who are you and what do you do?
Thank you so much for having me here, Dr. Tolu. My name is Dr. Ndidiamaka Obadan, fondly known as Dr. Didi. I'm the co-founder and owner of youngerselfmd. It's a medical practice aimed at preventing and treating chronic medical conditions like high blood pressure, diabetes, and chronic kidney disease. So I'm a kidney doctor, a nephrologist. I'm board certified in internal medicine and nephrology, and I'm also a certified hypertension specialist. I'm a mom of three beautiful kids,
Wow.
and I'm a wife to an adorable husband.
Awesome, awesome. Thank you for the introduction. Now, curious minds want to know why do you do what you do? What's with you and kidneys?
That's a good question. Well, the kidneys are unique organs. They're very special. And, how did I end up going into nephrology? Well, in med school, I was one of those very studious, my colleagues would tell you, I was a very studious medical student.
Mm.
And I had a lot of interest and, always open to experiment and explore different areas. So, nephrology was one of those areas that triggered my curiosity. It made me, want to know more, I also had a passion for OBGYN, which is,
Mm.
gynecology and women's health. And so I had very many different passions. So I went into residency, and during my residency, I met this lovely fellow, Dr. Olabike. He probably doesn't know how much influence he had on my life.
Mm. Mm.
He was a nephrology fellow at the time and was very passionate. He was so passionate about nephrology and all things kidney. And I would say that he was a big influence in me choosing that route. And so it's a field that is really broad. It has a lot of you get to use a lot of all the knowledge that you've learned
Mm.
in medical school as a nephrologist, and you get to help people. And there's so many different, it's really broad too. So there's so many areas in which you can subspecialize in as well.
Okay, all right. So you had a good influence side. So interesting that many of us did. There was some person that whose passion for the field also piqued ours. So that's
Exactly.
awesome. All right,
Yeah.
so Doc,
Yeah.
we're gonna go right to it. Kidneys. We talk about kidneys quite a bit. Sometimes for our patients, we encourage them, got to take care of your kidneys. For those
Yes.
who are wondering, um, what are kidneys and what do they do?
The kidneys are two really small but very important organs that help with pretty much filtering the toxins from your blood. So, they help to produce urine, and that's pretty much what they do. They help to keep a lot of your systems in balance. They help control your blood pressure. They help produce important hormones like, I don't know how detailed you want us to go into here about, erythropoietin, some vitamins like vitamin D. And, they help with, yeah, they're very important organs. They help with your electrolytes. They keep your electrolytes like your potassium, phosphorus, calcium, all of those things in balance. And they also help regulate your sodium
Okay.
intake. So
All right. So your kidneys are very important.
very important. When you start to have problems with your kidney, well, we'll get to that later.
Yes, your
Um,
kidneys are very, very important. They help to filter out things that should not be in your system from just
Correct.
in general terms, and they help with production of certain hormones that are very important for your blood production. So kidneys are very, very important. Thank you,
Yeah.
Doc. So next question. For those who are wondering, well, how would I know if my kidneys are good? Like what tests do I need to do?
So yeah, that's a very important question. Because I mentioned that they're so resilient, right? It takes a long time for them to start manifesting symptoms, and usually by the time you start having overt symptoms of kidney disease,
Mhm.
you are kind of at an advanced stage. So that's something I always emphasize with my patients and my friends, clients, families, members, and everyone. You should have your primary care physician check your kidney function at least once a year, just so you know what's going on, because many times you don't have any symptoms. You'll just be walking around. They call it, like the way they call hypertension, the silent killer. Well, the chronic kidney disease or kidney disease can also be a silent killer, because you're walking around with no symptoms. When you start noticing sudden changes, like changes in the color of your urine, for example, you have blood in it, or it starts to become very foamy. You pee, and then it takes a long time for you to flush the toilet. Like when you flush the toilet, you have to flush multiple times because of how foamy your urine is. Or you notice that those are some of the symptoms. You can have a swelling in your eyes and on your body. When you wake up, you feel like you're a little bit puffy, or your rings don't fit
Fit.
as well. Yes. Or when you wear socks, you have some indentation. That's some sign that you're retaining fluid, and maybe your kidney is not working as well. Of course, there are many other things that can cause that, but these are things to kind of keep
Watch
in
out for.
mind.
Okay. All right. So things that you mentioned that I wanted to highlight, there's certain clues that you can um use to figure out that something's going on with your kidneys. The change in the color, the change in
In
the
the volume.
volume
Yes.
and how foamy it gets.
Correct.
Swelling in the eyes, and that's why it's important to go for your preventive care visits where you do your blood work, get your blood work done, you have a physical exam done, because the kidneys, you mentioned this earlier, and I tend to stress this with my patients. Your kidneys are pretty forgiving. They can take a lot of crap for a long time. So,
Yes, they are hardcore, man. They
yeah.
are hardcore.
So when you start to have problems with your kidneys, it's a big red flag that you've really pushed your systems really far. Now, Doc, I'm going to go back to this question again. How is your function tested? So for a patient who's wondering, and of course, we encourage our patients to see your primary care doctor and get individualized care. This is medical. These are medical suggestions for you. Of course, you should see your own primary care doctor to determine what's unique to you. But for those who are wondering, well, what kind of tests am I looking to do, or if I'm going to a doctor, like what kind of tests would they do to check that my kidneys are okay?
That's a very important thing that you just said, because this show, I love your show, and I'm happy to be a guest on it. But most of what we're talking about is really generalized knowledge, and
Hmm.
we humans were super complicated. We're complicated. So you need to make sure that you are discussing with your physician before you do anything. Um, so, how do you measure your kidney function? Well, there's something called the glomerular filtration rate, and this estimates how well your kidney is functioning based on how well it is getting rid of one of the toxic substances that we produce called creatinine. And so we call it the GFR. The only way you can get this is from doing blood work, pretty much. So you go to the primary care or your kidney doctor, your nephrologist, and they take your blood work and they tell you, you may hear them say, oh, your creatinine is high, or oh, your GFR is a certain number, and those are the numbers that tell you that there's a problem with your kidney function. So your creatinine is one of the toxins that get excreted when from your body, and so when you have problems with your kidneys, that starts to accumulate. It goes up.
Okay.
The GFR is an estimation, and I like to explain it to my patients as a form of that's how they stage you. That's what they used to stage you, and it's like a percentage, from 0 to 100. When you have 100% of your kidneys functioning, then your GFR is. This is just a very simplified, you know what I mean? Like it's
Right,
simplified.
right,
So
right.
100% kidneys are functioning great. And when you go and they tell you, oh, your GFR is like 30%, oh, well, that means you have only about 30% of kidney function left. So, and that's how we classify the stage. We use the GFR to stage what kidney disease that you have.
All right, so GFR is used for staging. It is done through blood work, and most of this they're usually routine. So they're not specialized tests in that sense. They're routine blood tests that are recommended at your yearly checkups. All right, doc, this is good. This is good. Next question.
Yes, and there are other tests that can indicate that you have kidney disease. Your
Okay.
doctor's, your doctor may or may not do. It just depends on your physician, and you can talk to them about it if you want to know. You can ask them to check your urine. Because sometimes you may have protein in your urine. You might have blood in your urine, and it won't show. Like we call that microscopy. You won't see it physically until they look at it under doing some special tests. So those are some of the other things very important for you to discuss this with your physician. Remind them, what's my urinalysis like? What does
What are you doing with it? What did this show?
exactly and let them explain to you, what does this mean? What does yeah, be curious about your health. I mean, it's your health, it's not theirs. So you
I
are in
like
partnership.
I like that you said that because
Yeah.
sometimes I would send my patients off to specialists and they'll come back to ask me what the specialist was done. I was like, you were there. You go for a service, like ask the doctor questions like, oh, what does this mean?
Yeah,
Look,
exactly.
we seem horrid and stuff, but
Yeah.
that's why we're there. That's why we're your physicians.
Slow them down. Slow
Uh-huh.
them down. Don't
Hey,
let them. Don't. No. 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 Don't let them. Take a note. Take a pen. And that's what I always say. Take a pen and paper if they're speaking some language. Yeah, because it's kind of hard, right? So as a physician, you're under a lot of pressures, and so you gotta take a note on pen and paper. And you have to realize that these physicians have been in training for a majority of the years of their life. So so what I mean by that is Rome was not built in a day, and so that's why you have to keep following up. So you might not get it all the first time,
right.
but you've taken some notes, so you put it in your diary or your jotter, right? And so the next time you come, you say, hey, so this is a follow-up visit. So the last time you mentioned this was going on and I didn't quite understand what that meant. And then you give the physician the opportunity to go over it again, and they'll explain to you in different ways until you kind of have a good grasp of what's going on. Don't try, because remember, those physicians, they've been in training all their lives. That's all they've been doing, right? So don't try to just in one visit, in one 15-minute or 1 hour visit, just know everything that they have been in training for all those years. Don't get overwhelmed. Don't get overwhelmed. Just take it in small sizes.
Very important you mentioned taking notes. It's okay to ask your doctor questions, to help yourself and help maximize the visit. Have your questions written before you go for the appointment, and be interested in your own care. Help, there are ways to ask and get a better understanding of what's going on with you. Okay, so
Exactly.
very,
Be
very
nice.
important.
Be nice to your physicians. Yeah. Don't bully them.
Well, be nice about it, but ask. It's a service you're paid for.
Yeah,
So I tell
exactly.
you when you go, it's a service you're paid for. So go there with that expectation, of course, without being rude. So really, really important. All right, next questions. Uh, what causes kidney diseases? And then I want us to talk maybe 3 to 4 most common causes of kidney diseases, because there are a lot. So just 3 to 4 for the sake of our viewers who are saying, okay, what are some of the things that can cause kidney disease, so they know, like, okay, I should avoid this or I should, stay away from this. All right, Doc, over to you.
Well, there are so many causes, and so I'm glad that you limited us to just 3 or 4 because they're. Well, let's go with the most common. Okay,
Most
the
common,
most
yes.
common is diabetes. Okay, that is the most common. And yeah, so it's very important that when you're diabetic, you should make sure that you're keeping close eyes on your kidneys, with all your physicians, and they'll also make you do a lot of other follow-ups as well. So that's the first one: diabetes, high blood pressure, and autoimmune diseases. There are a lot of autoimmune diseases like lupus and systemic sclerosis. Those things can cause, those are the three most common things that you should think about. There are some medications also that will cause you to have kidney disease. And sometimes it's because, you have to treat other things going on. For example, you have a cancer that you need to, even cancer itself can cause you to have kidney disease. What time constraint, but okay, all right. Well, so but there are a lot of things, but I think the most common, I was going to say that the medication used to treat something else, like if you have cancer and they're treating that can cause you to have kidney disease, or if you have to be on antibiotics to treat a serious infection, the infection itself can cause you to have kidney disease, but the treatment of the infection can cause that as well. And I think we've talked about the most common things here.
Awesome, awesome. I want to give a shout out, Dr. Yinka, the swim is watching. Jessica, hey, thank you guys for stopping by. Shout out earlier. But there's something that you mentioned here that's very important. We are or diabetes as a cause for blood pressure issues. As a cause for kidney issues, and high blood pressure as a cause for kidney issues, and as
Yes.
well as medications that are used to treat some things can also cause kidney issues. And
Yes.
I want to use this to emphasize that.
Medications that are used to treat things can cause kidney issues. That's correct. Yes.
Yeah, so I wanted to emphasize real quick the importance of preventive care and well checks. And one of the things that we see with patients is we start you on a medicine, we say come back in for blood work. It's like, why do I have to get blood work again? This is why. This
Mm-hmm.
is why
Yeah.
it is important to check that as medications go through your body, because they're filtered sometimes either through the kidneys or through the liver or through the gut
Exactly.
system.
Yeah, they're filtered through the kidneys many times. Exactly.
We got to figure out that they're not causing issues on the way out. So it's really important to be very careful and to follow up and ask questions. If you're not sure, okay, why do I need the blood test? To check to make sure that this medicine is doing more good than harm. Now, I won't sit here and say, as someone who's hypertensive, you have patients who say, well, I'm on blood pressure medicine, and when I read the label, it says can affect your kidneys. So why should I have to take it? So, Doc, I'm going to throw that question to you because I get that a lot, and I get my answer, but I say, well, so the patient comes and well, I read all the side effects, comes in blood pressure 170s over hundreds. I don't want to take the medicine because it could cause kidney disease. What would you say to that?
170 over 100. Oh my gosh, you. Well, that's very. Oh my goodness, yes, I get that a lot too. In fact, just the other day, I was talking to one of my patients who told me that the reason he wasn't going to take his medicine was because his dad died from a stroke. His dad had had a stroke and he was on high blood pressure medications, and he thought that was the reason his dad died, because the high blood pressure medications made him. And I say, so he probably had a ruptured, he probably had a stroke because his blood pressure was too high. And so, and it's the same way the high blood pressure ruptures the vessels in the kidneys and everywhere in the body, in the brain and all. So when you have uncontrolled hypertension, high blood pressure, you definitely need to take your medications. There are, as we said earlier, there's some medications that when not taken in the right dose and the way, at the right, the in the right, frequency as prescribed for your kidney function, they can harm your kidneys. But this is not something that you should just do unilaterally. You should be in partnership with your doctor. Have these conversations with them, understand what's going on with your numbers, and come up with a plan together. Let it be, he or she will educate you on everything you need to know, and then you'll make the best decision. Please do not just go ahead and stop your blood pressure medication just because all medications have side effects. The pharmacists, the
Potential.
companies have to write them down. They have to write every single thing down. And when they do the clinical trials and people come down with these things, they have to do these things. So, and there's a lot of regulations around those things, but that does not, it's individualized care, right? So you have to go and speak with your physician, and you'll review all the numbers, review your labs, see how you're doing. They'll examine you, they'll do a physical examination and determine what medications you need to take and not take. Don't just stop it on your own, because that's even more dangerous.
Yeah, have conversations. Be honest with your doctor about what you take and what you do not take. And there's also lifestyle changes too
Yes.
that can help. Now, I have a question here, though. Someone's asking that can we talk about herbal supplements causing kidney damage? It is very, very rampant.
Yeah.
Herbal supplements and hi Tiffany, thank you for joining. But herbal supplements, it's a big deal. And it is a potential cause of kidney and liver and other issues, but we're focusing on the kidneys today. So, what would you say to someone who says, "Doc, you know what? I have a lot of supplements that I want to take, and I've heard good things about them." How would you advise as far as caution with use?
Yeah. So this is a very important topic. And again, I think it goes back to the same lines of what we've been talking about. There are some supplements that are okay when you have problems with your kidneys, when you have kidney disease, and there are some that are not okay. So you have to have the conversation with your doctor and know exactly what's inside those supplements. Give him the bottle or her the bottle so that they can check exactly what is in it.
In it.
Because the supplements, they have names. They have other names, and you don't know what's inside it, and your doctor is not going to know, because one drug is herbal supplement is called this thing in this country,
Something
and it's called something else in another country, and it's different things. So what is it inside it? Bring the bottle and show it to your physician so that she can take a close look at it and let you know if it's okay to use. And just like with every other medication there is out there, some medications that are excreted through the kidneys need to be adjusted for kidney function. Might be okay for you to take it, but you may not need to take the whole tablet. You may need to take half a tablet or a quarter of a tablet, depending on how well your kidney function, what your
is.
kidney function is doing. Yeah.
All right, very important. Edible supplements are a whole other conversation. We can't really delve so much in it, but I also typically recommend checking liver and kidney functions with chronic use of supplements, because sometimes it's hard to argue patients or convince patients to stop. All
Oh
right.
yeah.
Another question, saying that are there foods, and that was going to be our next question. Like, Doc, 2 or 3 tips for people who are watching who are saying, okay, all right, Doc, I get it. Diabetes, high blood pressure. I want to make sure I don't have that. I'm going to exercise. I'm going to eat better. I'm going to do this. I'm going to do that. I'm going to check with my doctor. I'm going to ask questions about my GFR, my urinalysis. I'll pay attention to my body. But they're asking, Doc, 3 things. What are 3 things I can do to increase my chances of preserving my beautiful kidneys?
So wait, the question, you started by asking about diet, and now you're talking about the 3 things that you need to do.
Hey,
So
I did ask.
which one is it? Okay, but let's try to answer all of them.
No,
Okay.
no. Like, what are 3 things you would advise? Like 3 things you would advise, diet included, to help someone to help someone preserve their kidney function. Yes.
Okay, well, the first thing is, this is big because, medications. You need to figure out what kind of medications you're taking and what effect they have on your kidneys. A lot of times we take pain medications. I'm very big. This is something that is close to my heart because NSAIDs cause problems with your kidneys. They're very good pain medications, but they also have this massive side effect of causing problems with your kidneys. So before you just go ahead and start just popping all medications in,
Drop.
including herbal and supplements,
NSAIDs, big word drop.
non-steroidal anti-inflammatory agents, steroids, for example, ibuprofen,
Mhm.
Motrin, Aleve,
Advil.
Goody powder,
Mhm.
meloxicam. They put them,
Cipro.
they
Yeah.
yeah, you'll see it NSAIDs on the bottle. Sometimes they even mix it with aspirin. And they call it all other kinds of names. There's so many names out there. So yeah, those drugs. So the medication that you take, you want to preserve your kidney function, be aware of what you are consuming. Okay. Then another very big factor in preserving your kidney function, especially if you have these other conditions we've talked about, uncontrolled diabetes, uncontrolled high blood pressure, get them controlled, manage them.
Get them under control. Very
Yeah,
important. Yeah.
get them controlled and manage, take care of them. If
Take care.
you are obese, if you have excess calories intake, you gotta try not to. Yeah, the reason that I've been in a lot of training where you shouldn't use the word obesity, you should say excessive weight gain. So If you have excessive weight gain, you should reduce your caloric intake and try to lose weight, because that will also help preserve your kidney function. Obesity on its own results in a lot of kidney diseases, and we can go into that later. I'm happy to come back, Dr. Tolu. This is so much fun. I'm happy to come back
I get it.
and share some more about kidneys. But yeah, those are the three tips,
So be
or
very
four.
careful what you consume as far as medications, because it has to be filtered somewhere. Manage chronic conditions, very very important,
Very
and also
important.
weight management is very very important as well. There research showing that intermittent fasting actually helps with kidney function. So moderate food consumption is also very important. I also want to highlight the importance of eating clean fruits
Yes,
and
your
vegetables.
diet. Yeah, diet. So
Man,
that's a tricky part, because with fruits and vegetable, it's a highly specialized area when you have kidney disease.
kidney disease.
Because yeah, with kidney disease, the type of food that you consume is going to, they need to adjust it based on how severe your kidney function is. Because like we're talking about, one of the functions of the kidneys is to regulate your potassium, phosphorus, calcium intake, and vitamin, it helps with vitamin D production. So those things become altered. They tend to accumulate when you as your kidney function goes down. And
Okay.
also salt is also a big one. That's one of the reasons why you're retaining fluid and you're sweating all over your body. So as your kidney function changes over time, your diet will need to change.
Okay.
There's one that is very, sometimes controversial, but I think most bodies agree, about the protein intake. They don't
Intake.
recommend they take, too much
So good.
protein,
Okay.
just a good amount. And then as it changes, as your kidney function changes, they need to adjust your diet. So that's very dynamic.
Okay.
There's no one recommendation
Okay.
for everything. Discuss with your physician closely, who may, depending on how complicated your case is, they may ask you to speak with a dietitian as well, so that
Well,
you can come up.
so I wanted to emphasize that's really important. Food changes as kidney disease progresses. From a preventive standpoint, though, very important. I cannot overemphasize the importance of eating clean before getting to the point where there's kidney disease. I want to give a shout out to Fasakuye. Thank you so much for joining us. I'm honored. Um, but this has been very, very helpful. Our kidneys are able to handle a lot, but we need to preserve them because they're very important for filtering toxins, retaining things that we should keep, and excreting things through urine that we don't need to hold on to. Hydration is very important. Water. Now, of
Correct.
course, kidney disease. If you have kidney disease, that also needs to be modified. So we're talking ways to prevent ourselves from getting to the point where we need to make adjustments as far as our kidneys. Okay, so prevention is very important. Please schedule
Prevention
your
is very important.
very, very,
And, I don't know if we mentioned this. I don't know if we talked about, how high your risk is the largely dependent on your habits, like we've been talking about, your lifestyle, and some of it is genetics. Some of it you have inherited.
very
And there's something, sometimes, despite your best efforts, for example, if you have polycystic kidney disease, you're gonna have it. And so at that point, what you need to do, or when you speak with your kidney doctor, they will come up with plans for you to get on a transplant list, and get new kidneys from someone else, like your family member who doesn't have it, or from an exchange. You can get into the exchange
right,
program.
right. And so there's some things that are genetic, so it's not something that you brought on yourself. It's something that's passed on. But thankfully, kidneys typically, this is not a ballpark statement.
They're
You
die hard.
you can get away with one. It's just one. Someone.
Yeah, exactly.
So
Yeah.
so let's keep our kidneys in case we need to share it. Um, that too, right? That
Yes,
too. If
that
people
is so true. God knows that the organs that are the most important. Well, I know that my neurologist will argue with me, but then there are two hemispheres. But what I was going to say is, he duplicated all the organs, right? And so the ones that are truly truly important, you have two of them. It's not like the heart where you, but
It's important to really have one.
I know.
No, 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 no.
I know.
Just have one.
I know,
Oh,
right?
wow. Wow, wow. This has been fun, Doc. I really appreciate you coming. I'm sure those who are watching find this very enlightening too. Please be encouraged, regardless where you are, either from a genetic standpoint, either from a chronic disease standpoint, or if you are just like, oh, I don't have any medical problems. Really, really important to ask this question. Schedule a visit with your primary care doctor for a wellness check because prevention is very important.
Yeah.
Um,
Build relationship with your primary care doctors and your specialists. Make sure that you understand what your specialist is saying. And don't be, yes, ask questions, and they're, remember that they're on your side, they're with you, they're on your team. The specialists, they want to protect their organs, you as a whole, just as much as you do.
All right, awesome, awesome. So, real quick, last question. People are asking, how often do we broadcast this program? We tend to do Facebook Lives anywhere from 4 to 7 times a month, and I'll try to put that information at least a few days ahead. This has been great, Dr. Didi. Thank you so much for coming. Now, people are wondering, this Dr. Obadan, I want to know about her. Where can I connect with her so I can have her come talk or speak at an event, or where can I see her to get her services? Where can people find you?
Well, I'm on Instagram, and youngerself.md is my Instagram handle. And my website is www.youngerselfmd.com. And I'm also on LinkedIn as my name, Dr. Ndidiamaka Obadan. And I have a YouTube channel that just came up, and I can give it to you, the link, so that you can post it in
Share
your
it.
show notes. Yes.
All right, awesome, awesome. Thank you so much for coming. That being said, this is a wrap. Please, those who are
Thank
watching, make sure you share with those who will find this useful. It is good to share. Um, uh, it's just good to share. All right. That being said, thank you all for watching. And if you or anyone you know is in the Mansfield area that's looking for an awesome, a passionate, and a thorough family physician, I am she. And yes, Pastor Kuya, Dr. Ndidi is a nephrologist.
Yes. Thank you. Thank you so much for having me, Dr. Tulu.
It was
Thank
awesome.
you. This was
Thank you.
awesome. Thank
Mhm.
you.
Bye.